So thank you, Bet, for inviting me again. This is really outstanding, platform to present the data. Today, maybe I'm going to talk. This is the slides of my name, Mayo Clinic, 3 centers. There's a Rochester main center. I moved from here to here, much warmer climate. And thanks to some of the people I'm presenting here, particularly Santanu, and our collaborators, Michael Strano and Jagata, also Bent. I'm going to present a little later. So my laboratory is working for vascular angiogenesis, permeability, EPR effect for a long time, and I was in Boston. But right now, today, I'm going to present something about applications of nanotechnology. That's the session today, right now, and how we can imply for early detection for pancreatic cancer, and some of the ongoing project. I'll tell a little bit. So we are working for targeted nanotherapeutics for more than decades ago. Actually, obviously, it is known that targeted delivery of cytotoxic drug can be more effective. In case you can deliver it properly. And our earlier speaker very nicely alluded that stroma is a very important challenge, particularly stromal component of pancreatic cancer or similar cancer type. So the main question is how we can do that. And we published a long time ago that targeted delivery of gemcitabine, which is a cetuximab-mediated targeting agent, can be a very effective way. And we showed that gold nanoparticle conjugating targeted and drug is very, very effective, both in the primary tumor as well as metastasis. But the current challenge, actually, how we can make this to clinical practice, right? And what the right model would be. So my laboratory, actually, whole group of people working on the simple steps. As so many speakers alluded beautifully that you can design any drug, anything you can design, a lot of complex steps, and then you can publish a great paper. But eventually, when you go to clinical practice, simple 1 or 2 steps chemistry is the most effective way to deliver drugs. And exactly, we are working that area. But today, I'm going to just focus on some of the talks about single-wall carbon nanotube, which is another directions. I'll tell you why we are working on it. And it started very interesting way, actually. Okay. So, we are working in the angiogenesis lab. We do a lot of things. And one of my fellow right now in India, Chittapatro, actually made a molecule, actually europium hydroxide, inorganic nanoparticle, first time showing the interestingly and highly angiogenic, actually. This is we published a long time ago. Now, obviously, what is the mechanism? We didn't understand why it is going on. And at that time, Michael Strano, I met with him some point, and we found that actually single-wall carbon nanotube, in fact, triggered the ROS generation and very, I think, controlled manner, generating the hydrogen peroxide. And as you know, the hydrogen peroxide is a good and bad. So if you need hydrogen peroxide to get something ongoing, like angiogenesis. On the other hand, if you have too much hydrogen peroxide, it can be counterintuitive. So that's the way we started, actually. And very quickly, to summarize, that SWNT is a single-wall carbon nanotube, and a different chirality, and different kind of form. Is actually graphite in a rolled graphite sheet. A lot of speakers already described it very nicely. Now, why we were interested, actually, the near-infrared spectrum, where you can see that huge range of the PL values, and that's the beauty, and that's Michael Strano and Anand Jagata's group working on that area. So I'm a biologist and a biophysicist, kind of biophysicist, I should say. So suddenly, they start collaborating with me, and I can tell you right now. So this is one of the systems that Michael and our group found that GT15 swapped with carbon nanotube. One of the, that's another interesting area. Different and RAF can change the different sensitivity. This is GT15 carbon nanotube. With a collagen sensor, you can detect the hydrogen peroxides released by europium hydroxide, and that's we've discovered angiogenic properties, and also the VEGF, you can do the similar thing. Now, to make a long story short, what we found is SWNT can be a very nice way for detecting hydrogen peroxide, but interestingly, what if also found that this SWNT can be detected hydrogen peroxide inside the cells and outside the cells, and that's one of the difference between VEGF and europium hydroxide nanoparticle that promote angiogenesis. Now, there's another material Michael Strano they published, also using the 8015 wrapped nanoparticle, which can highly sensitize the nitric oxide. You can see that, this is quenching intensity, so the very, very sensitive and specific for this nitric oxide. Now, we utilize this system, and I can show you something that an incredible this technology Michael developed, and we utilize this system that we can do spatial and temporally, single cell level, we can monitor nitric oxide. Why it is implicated, I'll tell you very soon. So how we can apply this technology for novel therapy, or detections rather. Now, so basically, bottom line is we are also working several other projects with the aggregations of the protein corona of this system, and we also do how the DNA wrapped nanoconjugate internalize the cells. We did a lot of mechanistic studies. Coming back to the therapy implications. So what we believe that one of the major challenge of pancreatic cancer early detections, as you know that in a very bad disease and within detections of most of the people died within 5 months to 1 year timeline. And so it is unmet need to get the early detection system. And obviously, we are another very big issue. We are working on the real-time assessment of therapy. As you know that for cancer therapy, people getting drugs, but there is no way to detect whether the drug is effective or not in real time, unless you could do CT or something, and then you say all failure, right? So one of the idea we are developing, can we detect the real-time assessment of pancreatic or any cancer therapeutics? And pancreatic cancer is our main focus. Now, as you know, the pancreatic cancer adenocarcinoma, PDAC is one of the lethal disease right now. In the Mayo Clinic, my partner Suresh Chadi first time showed that pancreatic cancer as only one way to find out the biomarker. I don't say biomarker. That if you see the early onset of diabetic patients, sometime after age of 50, you can suddenly surge up glucose level, potentially 8 times so much higher, you can get pancreatic cancer. So that is the only way. Now, the major challenge is, how we can differentiate this regular diabetic patient versus early onset of diabetes, and that can leads to pancreatic cancer detection system. Now, what we are doing actually, we thought, and we published a couple of papers. Last in the morning there's a beautiful session about exosomes, and we have a lots of different publications that pancreatic cancer and other cancer, they secrete exosomes and they carry forward a lot of signatures. And some of the signatures. Now we know that coladromodulin that alter some of the key issues like in here islet cells. And there's a nice article we published, and some of the reviewers say that is called exosomopathy, because might be the exosomes carrying adrenomodulin that altered the islet cells damage and cause the insulin resistance. So one of the goal is we are working on exosomes as a biomarker. The major challenge actually exosome heterogeneity, because that tumor is secreting from exosomes coming up from everywhere. So how we can detect the tumor exosomes? And so we are fortunate enough. Hopefully this project will be. Hopefully next year we can present something. So we develop a new technology that can detect the single level exosomes and differentiate between cancer versus non-cancerous, and you can make an algorithm to find out the disease progressions. And secondly, also real-time therapeutic. So we can, by the way, the same in SWNT, is our base monitoring system. So again, SWNT sensors, we can doing the assessment of therapeutic outcome, and technically, the more carbon, kind of another diamond nano project we are working right now, and I think Bent will talk more. So the bottom line is there are lots of different possibilities. You can use the carbon-based particles. We are working mostly in the detections and in early therapeutic outcome. And I think I should stop right now, and is supported by this. And okay, thank you. Good time.
Thank you very much. Other questions?
Okay. We need some
So
coffee.
is there nitric oxide also could you use it also to detect for things where nitric oxide is produced in immune cells, for example, infections and things like that?
Absolutely, absolutely. So we have, we're working for sensors that very easily you can take a drop of blood samples and we can detect the level of nitric oxide in the some of the immune cells plus progenitor cells. We can do a lot of.
Like macrophage.
Absolutely. Macrophage is already published.
And you're not dealing with single molecules at that level.
No, we can detect single level, and you can do heterogeneous population. We can monitor at the same time.
Right.
And we just developed another ratiometric probe, which is nitric oxide and hydrogen peroxide ratiometric. So that's another reactions. Okay, thank you.
So